Hi, this is Sue from the Lordswood Osteopathic Clinic. Just taking a moment here to explain a little bit about your initial consultation. So the first time you come into the treatment room. So I think when people hear the phrase initial consultation, they don't always think they're going to get treatment. In fact, it is a question that we do get asked quite a lot. So that's why I want to take some time to explain that today. So although it's called initial consultation, yes, you will receive treatment if appropriate on the day. So let me just explain the outline of the appointment so you know a little bit more what to expect. So on the day you'll come in and you'll obviously be introduced to your osteopath. You'll come into the treatment room like we are here, and we will sit down and make sure you're comfortable, make sure you're you're at ease, and then we'll start the process of finding out a bit about your problem and your aches and pains, what's brought you here today. So that might involve asking us some questions, lots of things about the pain, how it impacts with your life. Is it stopping you doing anything in particular? What is it stopping you doing? And if it's a restriction in movement and mobility issue, where's that impacting in your life? How is that having an effect? All of those questions give us a lot of information about what structure's involved. So quite often, when patients answer our questions, it gives us areas to look at and where to start with the diagnostic process. And two, it also gives us an idea of your expectation and what you would like to receive out of treatment. So that's really, really important. If you're looking at a particular part or aspect of your life, your hobby, your lifestyle, your work that is affecting, then that's really important that we know that, so that we can help you with the treatment and the treatment plan and management to help and get you to where you would like to be and manage your and match your expectations. So that's the case history part of it. We'll then go on to a little bit about your medical history and family history, just to find out if there's been any sort of surgeries and accidents and things in the past, because that just lets us know a bit about what your body's been through and whether or not there's any particular areas that we need to be aware of. And then we'll go on to the diagnostic process. So we'll go through some testing and see what structures are involved, and whether we're looking at sort of inflammation based or we're looking at tissue damage, etc. And we'll explain obviously everything as we go through. All parts of the appointment you'll be have the explanation as to why we're asking something, why we're doing something, and at all times you are obviously completely open to asking of your own questions, and to obviously feedback any time to us if you're not comfortable at any time. So hopefully that helps as well. And then once we discover and discuss with you the diagnosis, then we'll decide as a shared process, we'll decide with you which the best treatment approach, and we'll discuss if you have any concerns about a certain type of treatment, and we'll explain what we'd like to do and how we'd like to achieve that. And then as long as you're happy with all of that, and we'll go straight onto the treatment and start to hopefully get you out of pain or free from those mobility issues, and help you get back on with your life and get on with what you want to do and what you love to do. So that's just a little nutshell really about your first initial consultation. However, obviously happy to have a discussion with you if you are wanting to come along but not quite sure whether it is something that's appropriate for your injury, or you just have some general questions. Happy to answer those, so feel free to give us a call on 01634 944 303. Or you can find more information on the website, which is lordswoodosteo.co.uk, or drop us an email. So happy to help, and thanks again for your time.